Hello, everyone. Thank you for joining us today on our podcast with IQVIA and reps Leslie and Robert. How are you both doing today?
Doing well, Chris. Thank you.
Amazing.
How are you?
Thank
Good,
you.
good. I'm doing well too. If you would take a moment and tell us a little bit about what you do at IQVIA, and we'll go from there.
Rob, you want to kick it off?
Yeah, I'll kick it off. Robert Osterhaus, been in IQVIA for over 6 years, been around life sciences or technology for almost 20 plus years. And specifically within IQVIA, I support our alliances and partnerships. And so, directly for the discussion we're going to have, I help Leslie build the vendor ecosystem that we are creating around our One Home for Sites product. So, really excited to be on the call and turn it over to Leslie.
Yeah, thanks, Rob. Hi, everyone. I'm Leslie Fries. I work in product management, as Rob mentioned, on the One Home for Sites platform that we were excited to launch at the end of September last year. I've been in the industry about 20 years. I actually started out as a research assistant in college and then went on to be a coordinator and then started working on site-facing technology through drug dev about 11 years ago. So the past 3 years, I've been working on One Home for Sites, and I really head up our site feedback program. So as we've designed this platform, we've really made sure that sites have a say in how it works and the experience in there. And we've really had to kind of pivot along the way to make sure that we're adjusting to, how sites want to interact with the platform. So we're really excited to be here. Thanks.
So I'm not familiar with the One Home for Sites platform. Can you tell me what's all involved with that? What does it consist of? What's the offerings to, I assume, sites exclusively?
Yeah, sure. So it's kind of a multifaceted platform, but it is a free platform for sites that they can use. Our very first focus when we took this on was we had about 20 or more site-facing platforms within IQVIA Technologies itself. So we had to really kind of bring our own ecosystem and make it easier for sites to access our own technologies. But then when we started talking with sites, they, quite candidly said, good for you, but I don't just work with IQVIA. I work with many different sponsors and CROs and vendors. So then we opened it up, and it's really a sponsor agnostic and vendor agnostic platform. And so over the past couple of years, we've been working on building partnerships with all of the different site-facing technologies out there to bring them into our ecosystem so that sites really do have one place they can go and get access to the systems that they have to use to run clinical trials. So really, first off, tackling usernames and passwords, right? Like making it easier to, have one credentialing information and then be able to access all the systems you need to run your clinical trials.
So just to clarify, these different vendors, if they collaborate with IQVIA, they give you some sort of access to their code, their programming code. So where just this one login will get you into all these vendors that you're associated with.
Yep. So long as you have access to their platform, right? So we really deal with the authentication, not necessarily the authorization. So each product still controls what you see once you go in their system or whether you have access to their system at all. So, but what we do is we do a handshake with these vendors with whatever existing SSO that they have. And we just say, hey, we recognize you, Chris. You're a user of One Home. You're a user of, let's say, Rave EDC. If you have access to Rave, you can get into Rave from One Home. You don't have to re-credential when you go into their platform.
Okay. And then immediately you can go to the IVRS if that's the case, and they're in your system as well. So that's nice. That is definitely a huge complaint of sites, having 15,000 different vendors they have to track login information for.
Yeah. I was talking about this a little bit earlier, but we go to a lot of conferences and we kind of talk about the same things, and we don't always see much action. And really, even last June, we had our first external non-IQVIA partners come in. So Metadata, Greenfire, Signant Health, they were some of our first partners. And I'm really proud of what the vendors are doing to really solve this problem for sites. We've been talking SSO for 11 years now, at least as long as I've been working with technology. And here we are in 2025, and we're still talking single sign-on. And the reason why we, haven't really solved the true SSO issue is because every vendor's been solving it for themselves. Every sponsor's been solving it for themselves. Every CRO solves it for themselves. But with the sites, they work across vendors, across CROs, and across sponsors. So that's why we really took the approach of having an open platform in which any vendor, whether you're running an IQVIA CRO study or not, any vendor can plug in. And we're starting to see, over the past 9 months, even vendors hearing about it through podcasts or through webinars, and coming up to us and say, we want to be part of the solution too. And even if we have maybe the same product offerings, right? We essentially are competitors in this industry, but coming together for the common good. We're really starting to see that needle move. Last year when we started this out, we only had in June 3 external vendors and 3 internal systems, and now we're up to 25.
Oh, nice.
So we have 9 IQVIA systems already brought in, and then 16 external systems that have been plugged into one home.
So I believe IQVIA is still the largest CRO, but to your point, is PPD on this platform or Icon or any of your competitors?
They can if they want to, sure, but
Okay.
we haven't launched them yet. No.
Okay, but hopefully they will, right? This would make the access for sites so much easier.
That's the plan.
Yeah,
Yep.
that's right. And I think that's why it's been so successful and we've been able to build so many partnerships, because at the end of the day, right, you have to use these systems to run your clinical trials. Why not make it easier for users to get in? We're not looking to replace any system. We're not trying to do what everyone else does, right? It's really an access thing. So for most vendors, it's been a no-brainer for them. They want to make it easier for sites to use their product. And if this can do that, then they're really happy to do it's a pretty low lift effort too. We've gotten it down to about 2 weeks, 2 to 4 weeks for a vendor to plug in. So it's not a big technical lift. And so that's why we've been able to grow the system, what we call the system library, which is just a catalog of systems, right, that you use for clinical trials.
And Monica looks like she has an itch that must be scratched. So.
Yes. Actually, thank you so much for being here and for being a supporters of SOS since the very first one. So we really have you guys on our heart. I actually have been have used in the past a platform similar, and for me, and I remember since then, I really wanted to I mean that for the studies to have that accessibility, because it makes it so much easier and so much I mean it's just a big assistance for the site, because you don't have to save all the vendors, you don't have to save all the passwords, you just go to that main house and then just do everything from there. And I absolutely love that. It made the life so much easier when we had that opportunity. And now that I'm hearing that we can use it without being part of a study, I'm gonna be the first one to register. I really do. So if let's say, for example, if a site like us wants to join, how do we do it? And is there any cost involved, or how does that work?
It's completely free for sites. So there are a few tools that we have created to empower sites and give them more control over their experience. You can, add your own studies that you're working with and affiliate the systems that are being used on those studies. And we have a task manager that sites can use to help organize things they need to do for studies. Add useful links, and we're bringing in contacts soon. But there's the way we look at it is it's free for sites. It's still a bit manual, right? So you can go in and set that up. What sponsors can do is they can actually plug in so that, Monica, if you log in and you're working on a study that's using it, all your studies are already there. All the systems are already affiliated for you. There's really no, cognitive overload. There's no manual administration that you have to do. So we still want sites to have control over their experience, but we want to allow sponsors to plug in to automate as much as they can for you. So there really is, how much do we hear? We need to reduce the administrative burden. We need to reduce site burden. This is such a low lift that sponsors can plug into and just automate all of that for you.
I absolutely love it. Hi, Jill. Thank you for sharing the link. I was going to ask for that. Okay, so I'm going to be definitely doing that on this platform. Now, is there any connection to, let's say, for example, if I am registered there and also register on the IQVIA registry for sites, is there any benefit to that? Like, we're gonna be able to maybe see more maybe the studies that are coming on, or the pipeline? I don't know.
Yeah, that's a great question. We're certainly talking about it, right? It's a new platform, and it's something new that our industry hasn't really seen yet. We've put in a lot of effort to kind of perfect the site experience and what they want that to be. And now we're looking at, okay, what can we do from a sponsor or a CRO perspective, and what channels can we give them to maybe publish pipeline, right? So you can see what studies are upcoming. So there's a lot of discovery work that we're still doing, right, to explore those opportunities. When I was at SCRS back in September, that question kept coming up. Sites they were saying they want to see studies, right? I just want to see what studies are upcoming. During the feasibility process, so much of it is transactional, right? Like, you only get to know about a study if you're being considered for it. So that visibility is something that we're hearing is important, and we're trying to figure out a way to incorporate that.
Very nice to hear that. I'm actually, like I said, I'm going to be checking this out today and registering. If you're a site, I highly recommend you to do it, because I did it with one of the studies. And since we had that opportunity, we were just like, why don't all the studies do the same? It makes it so much easier. Mm-hmm. Just one link that leads to everything involved on the study, basically.
Yeah. And it's it's an ongoing thing. I don't think we'll ever stop coming out with new technologies, right? There's always something new that comes into our space. So, as we continue to build out the system library and bring on more partners, that experience is just going to continue to get better. So I don't know that our work will ever be done, because technology will never go.
Yeah, probably not. Probably not, but thank you for everything you guys do, and thank you for trying to make it easy for the sites and for the whole ecosystem, basically, because we all get benefits out of it.
Mm-hmm. And we do have ways in which, if you're using the platform, if there's a system that you would like to see in there, it really helps us understand which systems are important to sites. So when you make a request, we can actually go to those vendors and tell them that sites are asking for them to plug in. So it gives them a little bit more motivation to be part of that ecosystem. And then we also have a feedback link. So if you're using the platform, we want to make sure that we're always listening to what our users need. And so that feedback goes directly to me, and then we work through the kind of product design to see how we can incorporate those things. So, like I said, our work's never done. We certainly want to hear from the people using the system. So anybody out there who's using it or going to start using it, please look for that feedback link on the main page. And if you have any feedback for me, certainly let me know. I love it if you love it, but I also want to know if there's things that we can be doing to make it even better. So keep those.
And there's no cost for sites, and there's no cost for vendors, tech vendors that want to be a part of the program as well. So if you see vendors that are not a part of our initial think we have, Leslie, 16 external vendors that have tiles. But if you see, and we're working with about another 10, but if you see vendors that are in the landscape that are not in the program, just let us know. We'd love your feedback.
Mhm.
That's good because it also could include the vendors that the site is using, like eSource and
Mhm.
things like that. So everything is just in one place. I really love this technology, and it's very helpful, at least for the sites, and it's just awesome.
Yeah, I think it's a really good directional move. We're starting to see the needle move in solving this problem. And, as long as we continue to, all stay connected and communicate, I think, there's so many things that where we can go from here, and just seeing industry collaboration at this level is the first step. And that's what's been so important about this project, is really seeing, these different players, technology offerings, right, come together and really try to solve this problem that we've really kind of created. Technology is almost having an adverse effect on sites because there's so much of it now, right? And so I was talking with some sites, and they're hiring, system administrators just to keep track of system access and all of that, right? And we never even would have thought about that at a site. When I was there, we had coordinators, we had our PIs, our sub-Is, our nurses. We wouldn't have thought of needing someone, with an IT background to help us with our clinical trials. So.
Exactly. I have more questions. So let's say, for example, this has the access to all the platforms, and besides that, is there anything else that can be there? Like, let's say, for example, maybe if the sponsor, or if IQVIA has that study on the pipeline, and is the CRO for that sponsor. It has like maybe documents or training or things like that are related to that specific study?
So we actually have an offering for training. It used to be called Drug Dev Spark, but now it's called the IQVIA Investigator Site Portal. So as part of that, they have a training module, which is already plugged into OneHome. The thing is not every single sponsor or every single CRO uses the same training platform. So we wanted to make it so that if you're using a different training system, that can still be plugged in as well. You're not limited to just what IQVIA offers.
Oh, nice. And now that you mentioned Drug Dev, that's the one I tested long time ago.
Oh, yeah.
So it's the same one.
Yeah. Yep.
Yeah.
So that's plugged in. But we've seen, when you log in, you'll see you have the LabCorp Investigator Site Portal, you have metadata, you have Signant Health in there, Clario, One and Health just joined. We have all of these partnerships. I mentioned there's 16 so far, and then our own internal products. So it's really great to see this grow. It's really great to have it in users' hands, seeing the uptick in, usage of it, and getting the feedback that, it is helping. Like you said, keep those things organized, having one place to go. And we're going to continue to kind of lead this march and bring as much of the ecosystem together as we can.
So Leslie, I have now that you mentioned that, I just another question came to my mind. So let's say, for example, I have 10 studies.
Mm-hmm.
And obviously every study will have different set of vendors.
Mm-hmm.
When the site register, they can register with all the studies and get a separate access, or how does that work?
So, like I mentioned, we're just an authentication tool. So you can go ahead and set up those studies, or if a sponsor is using it, the studies will already be there for you. The system affiliations will already be there if a sponsor is using it. If they're not, you can create those system affiliations yourself. But whether you have access to a system or not is still dependent on that integrated system. So that's why we're kind of able to do this global system library, is that we just do the authentication, and the integrating product still controls the authorization.
Okay, got it.
Mm-hmm.
Okay, got it.
So
All right. Well,
into
hopefully
the
you
system
get
yeah.
you get a lot more vendors after the SOS conference and more exposure, because I mean, like I mentioned, it will be so helpful for sites to just have everything in one place.
Yeah, and it's a collaborative effort, right? And so not only do us as technology offerings and different systems and vendors, we need to come together, but we also need to make sure that sites are part of the conversation. They're part of the movement. Sponsors, CR, like it's takes everybody to really move this forward. And like I said, last year at this time, we didn't have any external partners yet, and now we have 16. So it's really exciting to see that shift.
It takes a village. And are you both going to the SOS?
Well, I was just going to ask.
We'll be there.
Exciting.
Never been to
That's
Oklahoma
exciting.
City, so excited to check it out.
Same for all of us. The only one is just Brad.
Brad.
Everyone else have not been there, so it's very exciting for us to also get to see a new city.
Yeah, how'd he work that out? Get it on his home turf.
Because that was the agreement we made.
Well,
Since the very beginning.
Yeah, that was part of it. It wasn't, Brad didn't insist upon it. It was more the fact that just no conferences are there. And it's in the middle of the country where sponsors like to be, Chicago, Dallas. Well, why don't we just stay in the middle and go somewhere new?
Yeah,
right?
Yeah, I think it's great. Yeah. We're not going to Florida this time, right?
No Florida, no LA, no Las Vegas, no Dallas, no Chicago.
No.
Those are the primarily used areas, right?
And last year was such a great, for your first conference, right? It went off so well. It was a really enjoyable experience, really great discussions. So I'm glad to see that, we're able to do it again.
Yeah.
Yeah. Thank you.
And I would assume conferences are a great place to promote your product with the vendors that have booths there as well. And we'll have plenty of vendors for you to promote to.
Yep,
Awesome.
that's what Rob will be doing. He leads all of our partnership programs. So if there are any vendors here on the call that are interested in learning more and seeing how you can plug in, Rob's your guy to contact. And if there are sites or sponsors here that want to learn more, or you have some feedback for us, feel free to reach out to me anytime. It's something I feel really passionate about. I came to the product team to work specifically on this project. So it's a little labor of love for me. So.
Awesome. And we're kind of finalizing the pod here. Dan, do you have you haven't spoke yet. Do you have your usual ad ready?
Oh yeah. So you guys gotta come to Oklahoma City, obviously, but you gotta stay at the Omni Hotel because it's Oklahoma's finest hotel, and no more Airbnbs. Just get your room at the Omni, and we got good rates. And Chris, you can take it out. Hit end, and I will keep saying Omni.
Well, let's first give Leslie and Robert, in case they have any final thoughts that they didn't get to discuss.
Oh yeah, are you guys staying at the Omni?
Yep, I'll be there.
Thank you.
Great.
Excellent.
Yeah.
Two less rooms to worry about, guys.
Nice. Do either of you have any closing thoughts that we didn't get a chance to discuss? Leslie, Robert?
Rob and I will be out there. I think I get in on Thursday, so in the afternoon, and we'll be there through Saturday evening. So, nice. Feel free to stop by our booth, or if you want, to sit down and have a chat. Would love to meet with you and hear what's going on in your world, and see if there's anything we should be thinking about from a One Home for Sites perspective, and should we be exploring other things that you may need or have come into your world.
Excellent.
Awesome.
One Home for Sites. And
how people can get in touch with you guys.
Yep.
Well, they'll be at the conference.
Yeah.
Exactly.
Come to the conference. Okay. You don't need an email. Just go to the conference.
Yeah. One Home for Sites, one home for your Oklahoma stay at the Omni, and one home for Leslie and Robert and their booth.
There you go. I love
3
it.
homes, meta. Okay, one home IQVIA, one home Omni, one home booth.
There you go.
Let's get it, guys.
Yeah, Jill mentioned we're sponsoring the meeting room in a lounge.
Awesome. That was you guys. Thank you so much.
Yep.
That was
And
very helpful.
connect with us, even if you can't attend the conference, connect with us on LinkedIn. Rob and I are both there, or if you're using the platform, go ahead and submit some feedback, and that goes directly to me, and we can connect there as well.
Awesome. And it's IQVIA.com/onehome. And that's how you spell IQVIA. Everybody should know by now. But
Well, Jill, you're making it so they don't have to actually come to the conference to get this info.
yeah, Jill, hold on, Jill. Take that off. Take that link off. The one home is at their booth at the within the Omni.
No, actually, I wish everybody just tested so they can go to the conference and speak with Leslie and Robert about it.
There you go.
That's not a bad idea either, Monica.
Try it out. Connect all your portals, and then whichever ones don't work, go tell them.
Yep.
And then they'll go back home and go to work on it.
There you go.
Got it.
Awesome. Robert, any closing thoughts?
No, just safe travels, and we're excited to be there and appreciate the 30 minutes you gave us here, and really excited about seeing where this can go, and at the end of the day, obviously helping sites, right? So that's what we're here for. So
well, thank you guys.
See everybody next week.
Kudos to IQVIA. I believe they're the only CRO sponsoring Save Our Sites 2 years in a row, so that's commendable, and we really appreciate that as site owners.
We do. Thank you for joining us on the pod. Everyone have a great rest of the day, and we look forward to seeing you at the conference.
Yeah. Thank you.
Thank you.
All right.
Omni.